guys. So myself, Dr. Ankur, and today we have got Dr. Mrunal with us. He is academic clinical fellow in psychiatry, and he'll be discussing things about the pathways in psychiatry training. Because we are getting like lots of emails and messages regarding the psychiatry training. So we'll try, and Dr. Mrunal will try to simplify things how you can enter into psychiatric training. So first, he will start with the introduction and other things. So, Dr. Mrunal.
Hi, hello everyone. Hi. So I'm an academic clinical fellow with the University of Birmingham. My full name is Dr. Mrunal Satish Bandawar, and I work with here 25% in academic setup as a lecturer, and I am also a psychiatry trainee, which is my 75% of my time. So this is a training program which I am going through, and it's through the national recruitment which happens, and it's a 6-year run-through program. So Ankur was asking me that many people struggle to learn about what is core training, when to give MRC psych exams, and when to start working, what to do after PLAB 2. So I thought, okay, let's start with helping people and try to see what we can sort out from our side and give my background, my journey, how it was from India to here. And I also got many times questions about what you say, how to include an academic setup in the clinics here, what to do with that. So I thought let's start discussing about it.
Right. That's really nice of you, and thank you so much for joining us today. So, first of all, actually, we would like to know about the background and introduction, actually, for the psychiatric people. I mean, if they are coming to this country, just the brief background, maybe in a couple of minutes, if you can give us.
Yeah. Okay. So I did my MBBS back in India, and I grew up in India as such, I should say. My MBBS I finished in 2011 within the internship of 1 year. So after that, I worked at NIMHANS Bangalore for 5 years. I did my MD PhD there. But after that, in India, we don't have such of integrated academic clinical setup. We are either more in clinics or more in academics. And if you want both of them, you have to be at very FX Institute. It is very challenging many times. And don't know, the future wasn't looking very good for me. So that's why I gave PLAB, and I got in through here. So I had many options of going through different setups, like getting the GMC registration through many different routes. But I chose to work with PLAB because it was simple, it was straightforward. More of it was what I can do mostly, and it wasn't dependent on somebody else choosing me or not. So I thought, okay, let's go for that. Then I was looking ahead for this academic clinical fellow. So after a PhD, what I can do as a research and clinic. So this I chose, and I got into this. So I'm in second year now. So you can call it CT2, ST2, or it's very difficult to call what it is, specialty training as such. And it's a 6 years program. So I work clinical and I work research together. You build up your own portfolio and you work ahead. That's how it goes on.
Yeah, that's really nice. Okay. So, I mean, the guys, if you want to ask any question, you can ask, and after that, we'll be answering all your queries as well. So, Dr. Mrunal, first of all, we want to know about like what after PLAB 2, because many candidates, I mean, they do PLAB, they get GMC registration. So now they're working in the UK after doing the PLAB. So how they will and what they can do so that they can enter into the psychiatry. So what will be your advice to them?
Yeah, so it's a very good question, I said, because everyone coming through this post will have this question in their mind. And after PLAB 2, basically, you need to understand that psychiatry is not a very straightforward branch. Many people think reading the books or looking through the day-to-day life or psychiatry, or they see a lot of movies and all that, they feel, okay, this is like psychiatry and all. But it's not like that, okay? So I would suggest thinking that if you're very early in your career, work in psychiatry for some time. and only then decide that do you really want to take psychiatry ahead or not, because it is not a branch where you would know you want to work unless you have worked in it, because from outside it looks different, from inside it is very different. Okay, and you have to understand that many of these diseases what we go through are not curable, they are treatable. Okay, so a lot of different aspects of things would come up when you start working, and then you can decide whether you want to continue it or not. So if you are very early in your career, I would suggest to take up a job anywhere in the world, on this earth, I would say, to take up a job in psychiatry and think, do you really want to take psychiatry or not?
Right.
Okay. If that is there, yes, you have decided then, yes, I like psychiatry, I want to do this for whole of my life, then I would say, yes, go ahead then. So if you are in this position, you really have a lot of opportunities in Britain. Okay, everywhere, so many jobs are there. So now you have to think about, like, do you want to do psychiatry in UK? Because it is a bit different than what you have it in your country. Okay, so you have to think about that. So what I would suggest is take some non-training jobs.
Yeah, that's actually my next question. So, like, we come up this question quite often, like, what is a training post and what is a non-training post, and how after PLAB 2 we should go in training or non-training. If you can just simplify it for the users, yeah.
Yeah. So there is not a big difference. Okay, non-training posts are basically something which a trust wants for you, and it's just a job of a doctor. Okay, but even though if you are in a non-training post, you still would get most of the things what a training post is for. Okay, so in a training post, you are having one training number. Okay, and these are mostly GMC approved training, and you will be under Health Education England. Okay, so for example, in a psychiatry for first 3 years, what you have is you are trained in basic specialties of psychiatry, like you would get the exposure to inpatient setup here first. You would get an exposure to outpatient setup. You would get an exposure to old age, child, all that sort of things. So every 6 months or 4 months, depending on the trust you are working, you would be rotated in these different things. But what happens is you come under Health Education England. So that's why it's very easy for them to rotate you, because your salary is given by Health Education England. Okay. So that's how it is. Or else basically you come under something which is a structured program. If you are not doing this and you are working in psychiatry, you are in a non-training post.
Okay.
That's the only difference. But the day structure of it, like for example, you are working 5 days a week. Okay. Of which one, so you would have 10 PAs, that's how we call half days, isn't it? Half days. So at least one or two you will have teaching, one or two you will have as an administration work, one or two you will have your supervision, what we call as, like you would talk to your supervisor, how you are planning your days, how you are, that's like a training thing. So you would get a one-to-one sessions with your supervisor. So it happens even in non-training post. But just the only difference is you won't be under Health Education England. Okay. Your main job is not to get trained. Your main job is to only look for patients.
Right.
And you rotate as such like a trainee does. Okay. You would be placed in places where trust wants you to be there, because there are no doctors in that sense. That's the only difference between training and non-training. But even if you are in a non-training post, you would still get all the exposures as a trainee.
But I mean, in regards to their procedure, I mean, how they will be proceeding in their career, I mean, later on, I mean, if they are in training and non-training post. And also we would know a bit more about the core training and the specialist training here. And what is the pathway for a training person who is in training and the non-training? I know that training person will go very easily and they will be moving up in their career. But what about for non-training people?
Yeah. So when I was saying that there is not much big difference, isn't it, between that? But for becoming a consultant, okay, there are some guidelines, or there are some things which GMC or Royal College wants you to know before you become a consultant. Okay. So when you are in a training, it is you are rotated in a way that you learn by yourself and you can then become a consultant. But if you are in a non-training, we have to work in order to get all these things done. So it is, even if you are in a non-training post, and you still can become a consultant.
Okay.
But what happens is, like for example, if somebody is in a non-training post, he might be only in a forensic psychiatry post for 1 year. Okay, because that's what the trust needs him for. And so if he continues that for 2 years, so he of course get an experience in forensic psychiatry. But does he even know completely about psychiatry? Not that, isn't it? So you might have to work on your own portfolio to start rotating or looking for jobs in your own trust, or planning your way ahead, what you want to become a consultant in a non-training, and start getting tick boxed everything. Like for example, if you're in a non-training, nobody will ask you to do an audit. Nobody will ask you to what you say, to go for teachings, to do presentations, to do publications. And all. In a training, that is required because you will be pushed to do that. If you keep on doing all this and you have all the tick boxes which is required to become a consultant, you still can do that.
Okay.
There are solutions in GMC if you want to go through. So that is called as a CESR route.
Okay, CSR.
Yeah. Yeah. So that's a parallel route. In case even if you are not in a training, you are working on a staff grade or a non-training post, you still can become a consultant.
Okay. Right. And when this will come, side, where it will come?
Yes. So what happens is, if you are in a training, in first 3 years, which we call as a core training, your job is to get these basic skills of psychiatry, and there are competencies which you have to attain. So you could go through the Royal College or a GMC website, Gold Guidelines, what it is called as, and it will tell you what are the competencies the core psychiatrist, core trainee should have. Okay, so if you're in a non-training post, you can get this signed off by your consultant. Okay, but you have to do it by yourself. Nobody is going to do that. And you also have to do something called as Royal College exams. So, which is MRC Psych is a diploma which is given by Royal College. It has 2 theory papers which are MCQ based, paper A and paper B, and it has one what you say OSCE exam, which is like a CASC. We call it CASC. So that has to be done if you are in a training for 3 years, in first 3. Okay. After the first 3 years, once you finish all these exams, you can apply for specialty training. That will go on for 3 to 4 years, and you can become a consultant. This is a job journey of a trainee. If you are in a non-training, you can take your own pace. But if you have cleared your MRC Psych exam, you still can take paper A, paper B, CASP. Nobody will stop you. For giving these exams, you can do it even from India, from anywhere in this earth. It's not like you have to work in UK.
Okay.
Okay. These exams can be taken, but once you have passed these exams, you can apply for registrar post. You can directly go into specialty training. These all options are there, but this is just a part of it. You have to show that you have all these core competencies. So this exam is a part of your syllabus, but it's not the only thing for you to go ahead.
And what do you think, like, about the job perspective? Is it easy to get in psychiatry as compared to other fields, or what do you think about it?
I would say the amount of doctors required in psychiatry are much more than any other field, I would say, because you have something called community setup and all. That's why, and you would get a lot of job. Now, still, the number of doctors coming in for psychiatry are a lot here. Even though you have completely filled jobs, everything, still they will be in demand. Okay, so don't think ever that psychiatry will be saturated and all. Now it's not going to happen like that. a lot of jobs are there.
lot of jobs are there. Yeah, that's great to know. I mean, those who want to pursue their career, I mean, in the psychiatry, so it's a great opportunity at the time. They can come easily and work here in the UK. And one thing, Dr. Mrunal, like one person is asking how to create your portfolio while working in the home country. I mean, what they can do to make their CV better in their portfolio. So can they do something in the home country?
See, what you can do is basically, if you are joining core training in psychiatry, what is most importantly seen in the interviews or in the what you say the discussions what they do is, are you really interested in psychiatry? People will be there that who would just come in and do it and then they don't want it later on. So what you have to show in that interviews is, are you really interested in psychiatry or not? So whatever you can do in order to show this that you are interested in psychiatry is well enough. So you don't have to work here in UK in order to show that you are interested in psychiatry. I got a training post without working in UK. So it doesn't require to work in UK to get in training.
Right, right. But
so
I mean,
what you
okay,
yeah,
right.
You're asking something.
Yeah, I mean, so for example, if I'm in my country, I'm in India, in Pakistan, and my plan, like, I do lab and work here in the UK as a psychiatrist. So is there anything like maybe audits or something I can do in my home country that will be helpful in getting a training post here?
Good question. Basically, you can have some exposure of psychiatry there, work for some years, or else you can publish something that will be helpful. Audits we generally don't have in our country.
Yeah.
We generally don't have, because that's not the process how it goes on. So I am not sure how can I advise to do an audit unless your institute there in Pakistan or India does an audit, isn't it?
Yeah.
But or getting an exposure, working there, going for conferences, then that will help. But if you don't have that at all, and you still are interested in going in psychiatric training, apply for a non-training job in UK. Okay. So if you have a non-training, that shows, isn't it? Like if you are going for an interview and you are asking that you want to get into a training in psychiatry, so I would be the first person to ask you, how do you know that you are interested in psychiatry, isn't it? Because the first person also came and he also told the same thing, that he is interested in psychiatry. How shall I grade? So I will ask him, okay, what have you done in psychiatry then? And if the person says, no, I have never worked in psychiatry, I have worked in surgery for a long time. So whom I will give the job, isn't it? I would try to give a job in a person who has worked a bit in psychiatry. He is thinking, okay, he is interested in it. And okay, let's see him, isn't it? But if a person who has worked whole of his life in surgery and now he's directly coming and telling, okay, I want to get in training in psychiatry, how would you give it, isn't it? It's a commitment from Health Education England to you. So I would suggest is just work in psychiatry and then you would be in, because they need every year some jobs go vacant just because they are not getting the candidates, isn't it? So what does it mean? Even if you show some interest, you are surely going to get that.
And there is one more question I think you have already answered, so I'll just read it for you. If I haven't worked in psychiatry in the past, can I try as FY2 or ST1 for a few months in psychiatry to get acquainted with it?
Yes. See, non-training jobs, you would surely get even if you are not experienced. I would say the training jobs also you would get even if you are not experienced. It's not like you won't, but you have to show that how you are interested in psychiatry. That's all. The major thing is asked in the interview. Why psychiatry?
Why psychiatry? And I think this is one of the tough questions. I mean, if you're giving any interview and somebody asks, why this? Everybody knows that this question will be asked, but maybe many of us will not be prepared to answer this question.
So I would say yes. So when I was asked this, I have defended in saying that I have worked for 5 years in psychiatry. Okay, I have done this research in psychiatry, and this is the aspect of psychiatry I like a lot.
Right.
That's why I want a psychiatry, isn't it? I see myself 5 years, 10 years down the line as a psychiatrist, as seeing psychiatric patients. That's why I want psychiatrist. That's a simple answer of it. But unless you have something in your bag to open and show, okay, this is why I'm saying I want to be a psychiatrist. It's difficult to defend that question, isn't it?
Of course, of course. And can you tell something about this community psychiatry? What's this about?
Yeah. So the health setup here is very different than what we have in our country.
Okay.
So in our country, psychiatry is basically mostly a tertiary care setup. Okay, like I'll tell you, you would have good psychiatrists in government hospitals, which are, for example, in Delhi, you would have it in AIIMS and big hospitals. Okay. So when in India, I know this, they have started new thing in last 1 decade was something called district mental health program. So they wanted to promote psychiatrists in secondary care setup. Okay. So me, at district hospital, you would have psychiatrists. Okay. Here it is even till primary care, but mostly psychiatry is a secondary care. It's not a tertiary care. Okay. For example, I have a postcode here, and there are 4 or 5 postcodes which come together. And if a GP needs his patient to be seen by a psychiatrist, where will he send him? So he will send to a psychiatrist. So this is community psychiatry.
Okay.
So the setup here is more on a community driven.
Okay.
So you would have a team which will see this area, which will cover this area as a community psychiatrist. So you will have psychiatrists, nurses, community psychiatry nurses. You would even have social workers, psychologists. So it's like a secondary care for patients. Okay. But if this patient needs an inpatient admission, then this community psychiatrist or anyone can refer to the inpatient setup. But it's not like every patient of psychiatry needs an inpatient setup, isn't it? So this is seen by a community psychiatrist. So psychiatry is mostly a community treatment. It's not mostly an inpatient treatment. That's the difference between old age psychiatry, what we think, which was mostly an asylum based, like where everyone was put in asylum. Now it's not like that. So it is probably 3-4 decades back it was that.
Right. And what do you think? So, what do you think? Like in terms of like, say, you are doing a job, and when you come back, like personal life, professional life, is it easy? Because many people they ask, when I'm working in the hospital as a psychiatrist, it might be a bit difficult for me when I'll come back home. I may bring something from the hospital, like the mental health and all those things. What do you say about these things?
See, it's difficult to answer. See, stress is there, but which job doesn't have stress, isn't it? It's like if you're not having a bit of tension in any job, you're not doing anything, isn't it? So everyone knows that there is something. The advantage here is if you are working from 9 to 5, you are working from 9 to 5. After 5, you don't have to pick up the call of the patient. You don't have to talk to anyone, and nobody will even call you for this. So your job is very restricted from 9 to 5. Okay. After that, you don't have to see. So basically, then now we have to plan and train ourselves that we don't carry the work home, isn't it? So you can keep that boundary. But the work-life balance for psychiatry is very good. Okay, I can promote psychiatry in that sense. You have an option as you grow, but slowly you would know what you want. Many people like to do on calls. Many people like to work emergency in psychiatry. Many people don't. So you choose branches in psychiatry which are not having any emergency. Okay, it's not needed that you have to work in emergency.
Okay. I mean, yeah, it's a personal basis. Like if you want to, right. So one of our users is asking, I'm interested in joining the GP training program in August 2021. As psychiatry is important, are there doctors that do non-training jobs in psychiatry while waiting for the GP intake? I'm not sure whether you can tell something about this or not.
I would say every GP would be probably placed sometimes in psychiatry. They expect that because I would say most of the job as a for mental health is done by GPs, not done by the psychiatrists. I'll tell you frankly, because
Mhm.
the as I said, it's a community setup.
Mhm.
Most of these depressions, most of the treatment of mental health are done by GPs, are not done by psychiatrists. I'll tell you frankly. So
Mhm.
if the person is interested in working in psychiatry, it's always well and good, because in if you are even a GP later on, it will be what you say a feather in the cap
Mhm.
to have worked in psychiatry for some time. So
Right.
it's always be helpful.
Uh-huh. Right. I mean, that's a great answer. I mean, yes, everyone, I mean, GP, they have to do the work for every department, whether it is medicine, surgery, gynae, pediatrics, and definitely psychiatry as well. So it will be
Mm.
helpful whenever you are interested in joining the GP in August 2021.
Yeah.
Right, all right. So that is like very briefly and nicely explained in very small session. So that was really nice. So anyone want to ask any question? We'll be here like for next couple of minutes. Anything else, Dr. Mrunal, you want to discuss with people?
I would say many people have asked me about the academic exposure,
Mhm.
because we have just talked about more of clinics, isn't it? If somebody is more interested in research
Mhm.
and you wants to do clinicals also, what would you do?
Mhm.
Because NHS is not a research, it's a healthcare, isn't
Mhm.
it?
Mhm.
So if you are interested in research, then what to do?
Mhm.
Well, I have done my MD PhD in India, and I never wanted to leave my research. I wanted to continue that.
Uh-huh.
Then what's the opportunity for it? So we in UK, there is something called academic clinical fellow.
Okay.
Okay.
Mhm.
So you have, if you're interested in academics, you have it from the foundation itself.
Mhm.
So there are seats for, these are NIHR funded most of the time. So there are seats in foundation. So you
Mhm.
can get academic foundation program. You can get in academic clinical fellowship program. Then
Mhm.
there is something called clinical lecturership program after the core training. And then you can be an academic psychiatrist or academic clinician. Okay. So many people ask me, okay, well, how to get in there and all. So
Mhm.
when you have core training opening again, along with that, you would see even the academic opening also, and you have some interviews which is done by NIHR and the universities. So you will be working along with universities, and you would have, see, generally if you are in a training, you have one clinical supervisor and one educational supervisor.
Okay.
So with this, you will be even having one academic supervisor. So
Right.
you can plan your research, you can apply for fundings, you can get some funding off, and you can even do parallelly research work along
Mhm.
with your case.
Along with
This
that.
opportunities I haven't seen much everywhere.
Okay.
So you have to. It's quite competitive. You have to work on that, and then again, as you would apply there, you would be asked why this post. So you have to be able. You have to be able to give answer to that. So,
Right.
but that's something which is also I would like to promote and tell people that if you are interested, apply for these posts also.
Mhm. Mhm. I mean, that's great. I mean, if you want the research and also this is a big opportunity for them. I mean, they can do this thing for sure. Right, right, right. There's one more user asking us. I think this also has been answered, but still, I'm a PLAB 2 candidate, but because of the current corona situation, I'm really worried when to take the exam, and I'm really interested and want to work in psychiatry in future. Shall I join anywhere for a few months in my homeland in psychiatry?
Well, my answer is yes. If you are interested in psychiatry, why not to work in psychiatry and see?
Course, of course. I mean, moreover, when you will come here so that you can say in the interviews, yes, I have worked in the psychiatry, and definitely your chances of getting the training post will increase. And
Increase.
you can prove also that I'm interested in psychiatry because I worked in the psychiatry. I think I also got the thing if I want to go in the psychiatry in future, what I should do. Right, right, right. Yeah, so that was like a brief discussion about the psychiatry. And guys, if you have got any more queries, definitely you can email us, and you can ask in this thread as well in the Facebook, and we'll be more than happy to answer. Right. Right, Dr. Mrunal, anything else before we wind up?
Yeah, if anyone has any questions, they can ping in there, and you can forward it, and if we can try sorting them out and
Right,
try to see how it goes on.
definitely.
There was one thing also. People ask if they have an experience in psychiatry. For example, my friends were there who did MD psychiatry in India, and they wanted to come in here.
Mhm.
So what to do? You might get that question, isn't it?
Yeah,
What?
if a person is already working as a psychiatrist, so they ask, like, do they have to do the whole training pathway from core training to specialist training, or there is something that we can do quickly to become a consultant? Because I'm working as a consultant in my country, then why you want me to work for 6, 7 more years? So
Yeah. I would say there is an option we call if they don't want to give lab,
mhm.
so they can be sponsored by Royal College
Okay.
or GMC registration.
Mhm.
Okay. So there are two ways Royal College sponsors your GMC registration. You don't have to give lab for that.
Yeah.
One is through what you call this IMT, not IMT. What is it like? Um, MTI. Sorry, Medical Training Initiative. So
Mhm.
where you would be given 2 years of exposure here as a training, okay,
Mhm.
and it's more like an exposure to what you say psychiatry here, and learn from here. And the motive of it is to give you exposure here, learn from here, and go back in your own country and work. Okay,
Mhm.
if you want to just get a small exposure for some years, that's a very good way because you don't have to give back for that. Okay.
Oh.
Uh,
Mhm.
but in that 2 years, if you feel you want to continue ahead, which is not the motive of that, but still, if you feel you don't want to go back, you want to continue here. The other way is, and you want to get ahead in your career, you may not be needed to continue as a training. You join as a training. As I said, we can give the MRC psych exams,
Mhm.
make sure we have tick boxes all the core psychiatry competencies, and
Mhm.
apply for a specialty training
Right.
directly. Okay, so you would be like a trainee registrar for 3 years or 4 years, depending on the specialty what you join,
Mhm.
uh, and then you can become a consultant directly, CCT, what you call.
Okay.
Okay, if you don't want even that, you still want to just work as a non-trainee, you give MRC Psych exam,
Mhm.
get all this CESR, what I called, you get all the tick boxes what are required for a consultant,
Mhm.
get all the paperwork, and you can apply as a consultant directly.
Okay.
So, but it's all about paperwork. If you are able to complete your paperwork, you will get it.
And is there any difference between a CCT consultant and a consultant through CESR route, or both are same?
That's the only pathway I would say. But
Uh,
at the end, both of them are consultants. There is no difference.
mhm.
It's GMC able to recognize you as a consultant. Okay.
Oh,
So GMC has three register. One is general register, where everyone who passed PLAB 2 and apply for GMC register will be in that. Okay.
okay.
So it is from even UK and from outside. The
Mhm.
second is you take GP as a training.
Mhm.
So you complete your GP your training, or you get through parallel whatever you can, and then apply for GP register in the GMC. Okay, so once you have done the training, you can get in a GP register.
Mhm.
The other is a specialist doctor.
Mhm.
So if you complete a CCT or a CESR, your name is in that specialist register.
Mhm.
And so then you are a consultant psychiatrist, okay,
Mhm.
like a consultant endocrinologist. So
Mhm.
your name is there. So there is no difference as such after that. You can call yourself consultant. Nobody will ask you, oh, you are a CSR consultant, you are a CCT consultant. I don't think so. In UK, it won't be different.
So, I mean, in the UK, there is no difference between a CCT and CESR, but yeah, you may have some difference if you want to work somewhere else, maybe in the Middle East or something later on. But in the UK, both are same. Both will be
Both are
having important, same salary, and everything will be the same for both of them.
everything will be same. Everything will be same.
Right, 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 right. Okay, so there is one person asking, how about the location and specific trust? Are there places that have more opportunities than others? I mean, for example, like working as psychiatry in NHS Scotland is better than in England. So is something different like that?
I haven't worked in Scotland, so I am really not aware how that will be. But I would say that there is going to be a difference in what you say, a bit of it, like your work-life balance will be different. In if you go in a rural setup, and if you work in urban cities, like I work in Birmingham, you go to London, so you of course would have that differences.
Mhm.
Okay, that's everywhere, isn't it? It's not like in UK only. It's everywhere. You go to your rural setup. It's not that that you would get less exposure and all. You would have still the same, because the setups here, the doctor distribution is not on the size of the town. It's on the population, isn't it? So if you are going in rural setup, there will be one psychiatrist or one community mental health team in possibly 6 towns, isn't it? So people will be traveling and coming to you. But in, for example, in Birmingham, you have 8 or 10 mental health teams, isn't it? So
Mhm.
because the population density is more,
Yeah.
it's going to be same.
Mhm.
I don't know. I don't think there will be big difference as such, but probably you might have to travel a bit more, isn't
Yeah,
it?
that is
That's
true.
what I'm saying.
All right, that is great, I guess. I mean, so that was a brief about the psychiatric training. And any questions, so you can ask maybe via email and look at our website, and you can get some maybe say phone number, and you can just WhatsApp us and ask in the thread of this uh, Facebook Live as well, and we'll be more than happy to answer that query. All right, so thank you, Dr. Mrunal, for giving us this time, and it was such a nice experience, actually. I hope this was helpful for all the users as well.
Thank you. It's
Uh,
always my pleasure to be with everyone.
Thank you, Dr. Mrunal. So have a nice day
Thank
and
you.
enjoy.
Thank you.
Bye. Bye.